allergy capital of the world? This morning, our Kelsey Starks is being put to the test, the allergy test, what you need to know if you live in the Ohio Valley. We've got him up early testing this morning.
Yeah, all of us suffer from allergies. Just about everybody in this part of the country seems to suffer at one time or another.
I haven't been tested, though, so I'm anxious to see this.
I haven't been tested since I moved up here. Had a bunch of allergies, got a whole bunch of shots for about 2 straight years in Florida. Was doing great. Moved up here. I just haven't been yet.
Oh, I was going to say.
It's only been about 4 years. Right now, the doctors are going, hello, come on in, get tested.
It's time.
And not too bad out there right now as far as the allergens go, because the rain kind of got things.
Got rid of.
Hey, and take a look at this. Do you know what this is? Yeah, you may have them in your bed and not even know it. We're going to talk to an allergist, and I'm getting tested coming up later this morning. Stay with us.
This morning, in what's going around, sneezing and watery eyes, a distinction Louisville may not want.
No, according to one report, Louisville is actually ranked #1 in the country when it comes to spring allergy capitals. WHAS 11's Kelsey Starks joins us live from Family Allergy and Asthma on Shelbyville Road. Big morning for you, I understand, Kelsey.
A big morning because I get to start taking my allergy medication again after today. But yeah, that's right. Louisville is #1 for allergies and asthma, the allergy capital of the world. In fact, here's the top 5. Louisville. #2 is Knoxville, Tennessee. #3, Charlotte, North Carolina. #4, Madison, Wisconsin. #5, Wichita, Kansas. But #1, the top of the list, Louisville, Kentucky. Now, as I mentioned, a little bit later today, I'm going to be tested. So I have been off of my medication here for a little bit, for about a week. This is Dr. Jim Sublett. He's talking to us today about how we can avoid allergies besides medication.
Right. There's actually 3 ways you can treat allergy. One, of course, the medications that most people have tried before they see us. Another would be allergy shots. We're going to talk about that later on after we test you today. And then the third thing, a lot of times people don't realize there are things you can do to reduce your exposure, or what we call avoidance measures. For instance, this time of year with the pollen very high, you may want to consider, if you're doing any kind of yard work, mowing your grass, wearing something like this NIOSH 95 mask. These have gotten a lot of publicity in the last couple of weeks because of the flu, and they're also recommended by the CDC for the flu. But for, if you have allergies and you're doing any kind of yard work, or even doing housework can help. Another thing you can do, if you have dust mite allergy, 2/3 of people actually have year-round problems. Is do encasings on your pillows and on your mattresses. That can really help. For both kinds of allergies, indoors or out, you can use something like a high-efficiency allergy filter on your furnace, and that can really help.
Absolutely, and you can get these anywhere. I know I have one of these as well. And here's what we were talking about earlier. These are little dust mites. Yeah, they are all over. You can't even see them, but they can cause big problems for allergies. I can tell you that firsthand. Coming up in a little bit, we are going to test my asthma first and then get into the allergy testing as well. So you're going to want to stick around for that. Back to you, Andy and Rachel.
All right, Kelsey, thank you very much. And there's the information. If you want to get a hold of them, you can call that number right there, 429-8585, or go to their website. We've linked you up through our website, WHAS11.com. That dust mite was scary.
I thought it was just a stuffed animal.
I mean, it was. If I saw a dust mite like that, I'd certainly want to get checked.
You know what? We want Kelsey to answer. We have some of the symptoms. At what point should you get tested?
Right.
I want to know the answer to that.
She's going to get prodded with all those little pins in her back this morning. Good morning, Kentuckiana. Our time right now. Good Monday morning, Kentuckiana. I'm Andy Trinan.
And I'm Rachel Platt. Still ahead on GMK, Kelsey Starks ready to undergo a series of tests this morning for allergies. Is it something you need to do? Right now, she's testing for asthma.
She was weaving on the way there.
No. Louisville, one of the worst places for people with allergies. This is the asthma test, I think, though, we're doing first. So more on that to come.
But first, want to get...
Plus, if you have allergies, chances are you may have asthma as well. You may not even know it. I know I do. This is the asthma test. We're going to do it coming up.
Thank you. Hey, if you're waking up this morning feeling congested with red eyes, you may be suffering from allergies.
And a new study shows Louisville is the worst city in the nation when it comes to allergies. WHAS 11's Kelsey Starks is taking allergies and asthma head on this morning, joining us live. And Kelsey, I don't know what age you found out you had asthma. My son was in 6th grade before we even had a clue, and it was a scary episode that made us realize he had it.
That's exactly right, Rachel. You know, so often people may have asthma or allergies and not even know it. I was diagnosed, I think, in high school. I was about 15 years old, but it's a scary situation. And the key, though, is to find out soon and get tested early and get it under control. And that's what we're talking to Dr. Sublett about this morning. So, as you mentioned, most people, well, I guess if you have allergies, kind of the symptoms are easy to tell, but chances are you may have asthma too and not even know it.
Right, we see about 30% of people that have allergy have a risk for asthma, and about 20% actually have asthma. The other side of that is about 30% that have asthma don't know it. So what we do when we see people with allergy problems, a lot of times they have a chronic cough or any history of breathing problems, we'll do a lung function test like you did earlier. Then when we get the baseline, we'll do a bronchodilator, and then wait a few minutes and then go in and do a second breathing test, which is what we're getting ready to do right now.
Okay, and so that's what we did earlier. So I'm going to take this asthma test, and so just show us what we're going to do here. You want to hang on to that?
Okay, so what we're going to do is have her blow back into our computer, and we can measure where she was previously and see how she does.
Big breath. Blow, 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 blow. Inhale, big deep breath. Take it out and relax.
Okay, great.
I put out all the candles that time.
That's right, you did much better.
Okay. You do it 3 times.
We're going to do a couple more here.
Okay. You can see the candles there on the
Right.
screen. Okay, here we go. Okay, big breath.
So as she blows, we can measure her airflow out of her lungs
Inhale, big deep breath.
and see how she compares to her previous test. And that's much better.
All but one. All right.
That's great.
All right, well, thank you so much. And coming up a little bit later, as we talked about allergies, you know, it is the #1 city right here in Louisville, and we are going to take that allergy test. It's not scary. It doesn't hurt. Don't worry about it. I'm going to do it live on the air coming up. Stay with us for that.
And Kelsey, you improved. Did you do medication? Is that what you were saying there? That the next time you did it and you did the blowing that it improved?
That's exactly right. What we did for the test, I did the first test to get a baseline of where I was. And as I mentioned, I'd been off my allergy medication. So we did the baseline, and then they give you the inhaler, which is actually called
Well, there's different types of bronchodilators we use.
Bronchodilator.
So that opens up your lungs once we take the original test and we give the bronchodilator, then we see how you do. You improve by 50%, which is a good number to have.
All right, so it just shows how much the bronchodilator can really assist with that asthma. So, and as we mentioned too, you know, it's so important to get tested early, and the time to get tested, Dr. Sublett says, anytime.
All right, Kelsey, thank you very much. But as you said, you were in high school before you even got diagnosed, and that happens a lot. Parents just not aware. If you want more information, 429-8585 or the website, familyallergy.com.
Proof is in the results right there.
Isn't that the truth? All right, what